Now, all this week, we are back at the hospitals of East Lancashire, looking at how the NHS is dealing with the consequences of coronavirus. At the height of the pandemic, routine scans were stopped, although urgent work continued throughout. Well, the Trust is now dealing with a large backlog and the fact that many people are still refusing to come. With the latest of her exclusive reports, here's our health correspondent, Gill Dummigan.
At the front of the hospital, it's full steam ahead on a new medical assessment unit.
We've never actually come to a halt through the pandemic. We've reduced in numbers but then evolved and picked the numbers back up, putting precautions in place to make sure people can work safely.
The unit aims to triage patients arriving at the hospital more effectively.
It's been our vision for 3 years. One of the aims of this building is to try and keep patients here who are potentially going to be in for a short space of time to be able to put that plan in place and get them home. Patients that then need specialist input and will have a longer length of stay, what that then allows us to do is pull those patients through onto the right ward with the right specialty consultant.
Breathe in and hold your breath.
Back in the existing building, the diagnostics team are beginning the day's CT scans.
I get one every year to check that everything's all right, because I had cancer about 5 years ago and they still keep an eye on me.
Urgent and suspected cancer cases have continued throughout, but at the height of the pandemic, some of the unit's more routine scans had to be put back.
Now we only have a backlog of approximately 1,000 patients. Initially it was 4,000 patients.
The Trust's increased the use of other sites and private hospitals, but new infection control measures mean everything's taking more time.
We're still getting the same amount of patients, it's just taking us longer to get through them, basically, because of the in-between. And obviously with us all wearing so much PPE, in between also the staff, once they've cleaned the rooms, they've also got to make sure we're all clean again, so PPE's all off, hand washed again.
For people who are much less urgent, who need a scan for something that isn't life-threatening, are they going to have to wait longer?
They will have to wait longer, there's no doubt about that. That's just a practical fact.
Clearing those waiting lists mean the people here, like all hospital staff, are working flat out.
And this is going to be hard. It's going to be hard on staff, because there's certain groups of staff who are absolutely shattered and have worked continuously for many, many weeks, and they're going to need to have rest and recuperation during the coming weeks and months. But at the same time, we still have our services to run.
Patricia's happy to use those services.
How did you feel today about coming in?
No problem. They give you the mask as soon as you come in. I had my own mask on anyway, but no, distancing's fine. Everybody keeps it left side.
But not everyone feels the same.
The Trust says that they haven't had to cancel any urgent scans, but a big worry is that far fewer people have been getting referred in the first place.
We still have about 800 patients that are refusing to come to the hospital.
800?
About 800 patients. For a variety of reasons. They don't want to approach the hospital, they're scared, they may be shielding, they might be self-isolating.
Doctors are particularly concerned about people who may have cancer.
I think we're worried that we will see that the number of people who are diagnosed at an early stage will reduce, and so we will see an increased number of deaths at a later stage, and that may be 1 year, 2 year, 5 years. It won't be an immediate effect. So this may well have an impact on the cancer survival statistics and on patients for a number of years.
All eyes are on the future. The medical assessment unit's due to open in December.
What do you think will be happening with COVID in December?
Very difficult. It's a bit like a crystal ball.
The Trust is already planning how to respond to a second wave.
Because obviously we've been in COVID now for 12 to 14 weeks, we kind of hit a peak. And what we've done is use that to model and predict what might happen. So if that was the worst case scenario, because that was where we got to in those 12 weeks, if that was to come again, what would it do? If it did come back but it wasn't as bad, these would be the actions.
This first battle against COVID is subsiding. The question now, how to function alongside it.
This is going to be a long work in terms of recovery, and we're not thinking about it in terms of weeks, not even months. We're thinking about this now in terms of years.
Gill Dummigan, BBC North West Tonight, Blackburn.